They told you brushing twice a day was enough. They told you flossing was the gold standard. They told you mouthwash could pick up the slack, and yet here you are, still visiting the dentist every 6 months, only to hear those same dreaded words. You've got tartar buildup. Like a ghost that never leaves, it creeps back into your life, hardening on the back of your teeth, hiding behind your molars, and clinging to your gum line like a silent threat. You brush, you rinse, you floss, and still, the tartar wins. But what if the battle was rigged from the start? What if the real secret to stopping tartar wasn't in the aisles of your pharmacy, but in something most dentists never even talk about? This isn't some late-night infomercial cure or a gimmicky gadget. This is science, and it's simpler and more powerful than you think. Because tartar, at its core, is just the hardened shell of a deeper problem, plaque that wasn't neutralized in time. And plaque isn't just some annoying biofilm, it's a living, evolving ecosystem of bacteria, fueled by what you eat, how you breathe, and even the time of day you brush. But hidden beneath decades of conventional dental wisdom lies a little-known truth. There's a natural, powerful way to disrupt the entire tartar-forming process without scraping, chemicals, or pain. It's not a replacement for brushing, it's a catalyst that makes everything you're already doing work better. And it starts in your saliva. Saliva isn't just spit. It's your body's first line of defense against oral decay. Packed with enzymes, minerals, immune cells, and even buffers that neutralize acids, your saliva has the power to dissolve food particles, kill bad bacteria, and remineralize enamel if it's supported correctly. But the modern lifestyle has weakened this natural defense. Dehydration, processed foods, chronic mouth breathing, stress, and poor nutrition all conspire to turn your saliva from a warrior into a bystander. And when your saliva's pH drops below optimal levels around 6.5 to 7.5, plaque starts to thrive, and tartar begins to form. So here's the hack. If you can shift the chemistry of your mouth, you can starve the bacteria before they ever calcify into tartar. Most people try to fight tartar with weapon scraping tools, acidic rinses, chemical pastes. But they miss the battlefield entirely. You don't need to fight harder, you need to change the environment. And the fastest way to do that: alkalize your mouth. This is where the secret begins. Alkalizing the mouth doesn't mean overhauling your diet or chewing on baking soda. It means strategically introducing simple, natural compounds that restore your mouth's balance, especially right after meals and before bed, when plaque is most active. Enter Xylitol. This plant-derived, naturally sweet substance doesn't just taste good, it literally starves harmful bacteria. Unlike sugar, which feeds Streptococcus mutans, one of the main culprits in plaque formation, Xylitol blocks their ability to stick to your teeth. And when they can't stick, they can't colonize. Studies have shown that using xylitol gum or mints after meals can reduce plaque by over 40% without touching a toothbrush. But there's more. When xylitol mixes with your saliva, it increases its flow and raises its pH, turning your mouth into a hostile zone for tartar-forming bacteria. But that's just one layer of the hack. The second is remineralization. You've heard of fluoride, but did you know there are natural minerals like nanohydroxyapate that are even better at strengthening enamel and preventing plaque from penetrating in the first place? Originally developed by NASA to help astronauts maintain bone density in zero gravity, nanohydroxyapate binds directly to enamel, filling microscopic cracks and smoothing tooth surfaces so that bacteria have nowhere to hide. When combined with xylitol and a neutral pH environment, the results are astonishing. Tartar stops forming not because you're scraping it away, but because it never gets the chance to harden. Then there's the third pillar of the tartar stopping hack: oral microbiome control. Think of your mouth as a garden. Some bacteria are weeds, others are flowers. Antibiotics and harsh mouthwashes kill everything, leaving room for the weeds to grow back stronger. But probiotics, yes, for your mouth, can shift the balance. Certain strains, like Lactobacillus reuteri and Streptococcus salivarius K12, have been shown to reduce inflammation, prevent gum disease, and crowd out the bad actors that lead to tartar. These aren't fantasy solutions, they're backed by peer-reviewed research from institutions across the world. And yet, most dental clinics never mention them. Why? Because dentistry is reactive by design. It treats symptoms. You get tartar, they remove it. You get cavities, they fill them, but the upstream prevention, the system reset that stops problems from ever forming, isn't profitable. A patient who doesn't need cleanings, fillings, or extractions doesn't drive revenue. That's why this hack is something your dentist likely won't emphasize. Not because they don't care, but because the system isn't built to reward prevention, but your body is. Once you shift your perspective from scraping to environment control, everything changes. You begin to notice how dry mouth at night accelerates tartar formation. You realize that a simple rinse with alkaline water after a sugary snack can neutralize acids before they feed plaque. You understand why snacking all day, especially on refined carbs, doesn't just spike insulin, but keeps plaque bacteria in a constant feeding frenzy. You start to see patterns, how stress changes the acidity of your saliva, how mouth breathing while sleeping worsens oral hygiene, how certain teas like green or black have polyphenols that naturally fight plaque-forming bacteria. And perhaps most empowering of all, you realize that stopping tartar doesn't require a $300 dental visit. It requires knowledge, timing, and a few well-placed habits. A daily xylitol mint after meals, a pre-bedtime swish with remineralizing rinse, a tongue scraper to reduce bacterial load, a probiotic lozenge after brushing. Hydration, deep breathing, chewing fibrous foods. Small things, but together, they create a cascade of changes. Even your toothbrush can become smarter, soft bristles, angled at 45 degrees, using gentle circular motions, not aggressive scrubbing that pushes plaque into your gums. Brushing before breakfast, not after, to avoid brushing acids into enamel. Flossing not just between teeth, but gently under the gum line, where tartar begins its invasion. And upgrading your toothpaste from fluoride-heavy foams to pastes rich in calcium phosphates, natural enzymes, and prebiotics. Then there's timing. Studies show that the window between 30 minutes to 1 hour after a meal is the sweet spot for disrupting plaque colonization. Brushing immediately can damage soft and enamel. Waiting too long allows bacteria to multiply. But a quick xylitol mint or rinse during that window? Game-changing. It shifts the battlefield in your favor. All of this isn't about replacing your dentist. It's about becoming your own oral health strategist. It's about no longer surrendering to the chisel and scaler every 6 months. It's about rewiring your habits, not drastically, but intentionally, to support the biological intelligence of your own mouth. Because your teeth aren't stone, they're alive, porous, reactive, dynamic, and the decisions you make today determine whether tartar takes root tomorrow. And here's something most people never consider: the link between tartar and systemic inflammation. Once tartar breaches your gums, it becomes a conduit for bacteria to enter the bloodstream. This low-grade, chronic exposure can fuel inflammatory conditions across the body: heart disease, diabetes, even Alzheimer's. It's not just about white teeth anymore. It's about cellular health, mitochondrial stress, hormonal balance. Your mouth isn't isolated from your body, it's the gatekeeper, and tartar is the Trojan horse. So the next time you brush your teeth, don't just go through the motions, think like a strategist. Picture the battlefield: plaque forming its colonies, saliva trying to buffer the acids, enamel absorbing the shock. Then deploy your weapons: not just a brush, but smart timing, natural chemistry, and microbial balance. A mint that flips the pH, a rinse that restores minerals, a lozenge that seeds the good guys. You're not cleaning, you're recalibrating. And if you're looking for that one hack to start with, the move that changes everything, it's this: switch your after-meal ritual. Instead of doing nothing or sipping sugary drinks, pop a xylitol mint. Let it coat your teeth, stimulate your saliva, and starve the bad bacteria. Do it consistently, and you'll start to notice smoother teeth, fewer morning odors, less sensitivity. Over time, you might even find your dental cleanings getting easier or unnecessary altogether. Because when you change the environment, you change the outcome, and tartar, it never stood a chance.